Okay, arthritis is the #1 cause of disability in the country and affects nearly 60 million adults and 300,000 children.
So according to a new study from the CDC, 1 in 5 adults suffer from arthritis, and there are more than 100 types of arthritis and related conditions.
And joining us now, Dr. Karena Wu, owner of Active Care Physical Therapy. Welcome, doctor.
Thank you for having me.
Now, you also work very closely with Arthritis Foundation, and that's why you're wearing green.
Yes.
I love that. And you have a couple of big events coming up.
Yes, we have the Jingle Bell Run December 2nd in Westchester and December 9th in Long Island. So if you want to sign up, it's open to everyone. It's about a 3-mile run.
Okay.
Is running good?
Running's a great exercise,
okay.
Sure. But depending on what's going on in your body, you just might need to interval run or fast-paced walk.
So speaking of bodies, these 3 bodies all suffer from arthritis.
Yes. Yeah.
I mean, and I mean, I'm not trying to be like glib or cheeky. I think we're all relatively fit people, but you still can suffer from arthritis.
Yep.
So you have some stretches that you and some exercises that you want folks to do at home. So.
Yes. Arthritis is predominantly in the weight-bearing joints for osteoarthritis, so I'm going to show you some exercises that help with movement because joints like to move, and that helps with calming the inflammation down.
Why I'm going to get on the box. Do I have to do all these on the box?
No, you're going to do this one on the box. It's better because your leg can hang, which gives more space in the hip joint. So this is for the hip, and you're going to do a leg swing. I'll come over here.
Okay.
You're going to swing the leg forwards and back and just let it swing like a pendulum. So you can do forwards and back, or you can do side to side here. And that will test your balance.
Ooh, should this leg stay rigid as this leg swings?
This leg would stay rigid. It would be better if you're holding onto a chair for balance. You're going to so you can cancel that out.
Oh, you know what? Have you done
better?
this?
No.
You feel it. Am I supposed to feel it?
Yes, you're going to feel the muscles moving, but that movement helps with the joint. It gets some fluid nutrition into the joint. So you just want to move the joint, but don't overdo it.
Because it's like it's a test for balance.
I know, but let's do what we're supposed to do.
Yeah, you get up here and do it.
So how many sets should he be doing?
So he can do like sets of sets of 1 to 3 repetitions up to 10. He's swinging the leg, moving it like a pendulum, just getting movement in the joint.
This one I can do.
In a controlled fashion.
In a controlled fashion, John, like slow and steady.
Oh, slow and steady.
Because if your joint is irritated, you can do this and it would actually irritate it more. But you want to move it in a controlled fashion where you're getting just light motion and calming it down.
Now I'm going to ask, I'm going to insert a question here. When we're doing all this stuff, when do you stop? As soon as you feel pain, or do you push yourself through the pain?
So there's good pain and there's bad pain. Good pain is, okay, this maybe like hasn't moved in a long time, so it should feel okay during and then after. If it is painful and it's progressively worsening and it hurts afterwards, that's when you got to stop.
Okay.
And then you
do need to learn that about your body.
You have a knee-calf stretch.
I do have a knee stretch. The reason why we stretch our calves is because it inserts on the back of the knee. So let's bring the left foot forward and just drop the right heel down, and that will stretch this calf right here.
Oh my.
Yes, so he's kind of bouncing. He's getting a little bit of blood flow in there, but you can also statically just drop the heel and hold it down there.
Wow.
And it will lengthen this tissue here, which will reduce the compression in the joint.
And you would do that off a step.
You can do it off a step.
Okay.
And if you do it on a step, you can hang onto the handrail, so it's easy to do.
You can also do it in this fashion, in a long lunge stretch, and the focus is on this back leg. You're keeping the heel down.
All right, they're telling us to get on the ground, so what do we do?
So this is the hamstring, back of the thigh, which also reduces compression in knee, because knee joints typically have a lot of arthritis. So you're going to lie down. You're going to use this strap with the loops, stick your shoe in it or your foot in it. That's the point of the loops here. I will sit like this, and you're just going to keep your knee straight, and you're going to bring that leg up.
I love this.
Within reason.
Oh, my God. You got to do this. Oh,
down.
yes, yes.
I'm going to stretch like this, and Cindy, you can stand up, and you can actually just drop your heel with your knee straight.
Drop my heel with my knee straight.
Heels might not be the best, but we can do it, and it's like this.
Oh, I see what you're saying.
Yes.
Yes.
So you might feel a little bit of a stretch there.
Yeah. That's good.
This is great.
But this,
I don't know why I don't do this.
Three different options. And this is great because we sit all day, our hamstrings get tight, and it compresses when it's tight. It squishes your knee together, which can irritate your arthritic joint.
I love this.
And, okay, you stay down there, John. Thank you, doctor.
You're welcome.
Really appreciate it.